A very good afternoon and welcome to the session on the topic weight gain in pregnancy. Considering the topic very essential for all the pregnant ladies, for the first timers, and all the ladies out there, we have the session especially for you guys. So, you have any questions, queries, or any doubts, you can ask the doctor. Stay tuned for the amazing details and the explanation by the doctor about the topic. So stay tuned till the last. Also, one more thing, the doctor will be taking all the questions by the last of the session. So if you have any queries, put that on the comment section and we'll answer your questions. Now I would give the stage to my doctor. Doctor, you have the stage now.
Yeah, thank you so much. Good afternoon, everybody. I'm Dr. Shilpi Sachdev, consultant obstetrician and gynecologist at Apollo Cradle, Moti Nagar. So, a very warm welcome to all of you. So, today I have chosen this topic, which is very important because as soon as a female becomes pregnant, she feels that she can have anything, she can gain any amount of weight, and she has all the freedom to do it. But that's not the right thing. So, we are going to solve all those myths what are related to the weight gain during pregnancy. So, for an average weight and height female, the weight gain appropriate should be between 10 to 12.5 kgs. Anything more or less is not good for the health of the baby as well as for the mother. So, gaining too much weight is predisposes to many complications during pregnancy, and gaining too less weight also predisposes to many things. So, we'll discuss it here. Now, gaining too much weight leads to gestational diabetes, that is, pregnancy induced diabetes. As the mother is eating too many sugars or junk food or fried food, so she gains too much weight, the baby gets many sugars in the body, hence, the baby becomes large for days, or you can say macrosomic baby. The fluid around the baby also becomes more, and hence there are problems related in the pregnancy phase as well as during delivery. As you know that the mother's bony pelvis is a fixed structure, and the baby has to negotiate through that, and baby is also the baby's head and bones are almost fixed structures, which if the mother gains too much weight, there is problem in negotiation through the maternal pelvis during labor. Hence, the chances of operative delivery or cesarean section increases if the baby's weight becomes too much. Also, after the delivery, when the baby is born, as inside the baby was getting too many sugars, so after delivery, the blood sugar as the baby is not getting now that much sugars how much the baby was getting inside the womb. Then, so the hypoglycemia, hypocalcemia incidence increases. Also, there is raised bilirubin in these babies. There are chances of reduced lung maturation in these babies. So there may be chances of respiratory distress. That is, there may be problems in breathing. Also, after delivery, the baby is more prone for getting diabetes and obesity in future. So we have to keep all these things in mind, considering that the weight gain should be very appropriate and a very nutritious, well balanced diet should be taken by all the ladies in the pregnancy. The other complication which comes up is pregnancy induced hypertension or preeclampsia. So, what is this? This is the say around after 20 weeks of gestation, the mother starts showing her raised BP, that is blood pressure, and this is maybe or may not be associated with some protein excretion from the urine. So usually, in most of the cases, this condition is not very serious, but it can be very serious also in certain cases. So, appropriate weight gain, again, I would stress, is very important during pregnancy. Now, if the female is gaining less weight, that is also hampering the growth of the baby. So, baby's growth is less, the fluid around the baby becomes less, and the delivery during the delivery process also, the baby is not able to take the stress of the labor, and hence passes meconium, that is passes body during labor, and the heartbeat sometimes drops, and there are more chances of distress and operative deliveries or cesarean section for these babies. Now, uh, so this is not the standard that the female has to gain, 10 to 13 kgs or 12.5 kgs. This is for an average weight and height female. This much weight gain is appropriate. But if the pre-pregnancy weight of the female is high, she comes under overweight or obese category, then she is not allowed to gain that much weight. If she is obese, then if she doesn't gain weight, then also baby will get the food from the mother's store. So the parents, the relatives should not get worried that the patient or the mother is not gaining weight during pregnancy, because she's already in obese category. If she is overweight, then yes, she's allowed to gain weight, but not to that extent. So even 4 to 11 kgs of weight gain is okay for such ladies. And if the female is suppose underweight, her body structure is that, or her she's little malnourished, or her pre-pregnancy weight gain weight is less, then even if she gains 12 to 18 kgs, that is also normal for her, or she should gain that much weight for appropriate weight gain of the baby. And for multiple gestation, this weight gain should be more. It is not same as singleton pregnancy. And in cases of twins, around say 15 to 25 kgs of weight gain is also appropriate. Now, as we have told that this much weight gain should happen, now trimester wise, how much the distribution of weight should be there? How, when you go and show to your gynecologist, how your gynecologist make out that yes, your patient is gaining adequate weight. So in first trimester, the patient should not gain more than 2 kg. So zero point 0.5 to 2 kgs weight gain is appropriate, and not more than that, because baby is not requiring that much nutrition at this gestation from the mother. In the second trimester, that is from 12 weeks to 28 weeks, and third trimester is 28 weeks till 40 weeks. So then the weight gain should not be more than zero point 0.5 kgs per week. So this should be the maximum weight gain during pregnancy. And now, how this weight gain is actually distributed in the mother's body, because mother is the baby is gaining approximately say 2.5 to 3.5 kgs at full term. So where the rest of the weight goes? Now, the placenta, this is the organ which supplies blood to the baby. Because of this, the weight gain is around 1 to 1.5 kg. The fluid around the baby, that is the amniotic fluid, it is around 1 to 1.5 kg. There is growth in the uterus, so uterus also enlarges. So the weight gain because of this uterus is around 1.5 to 2 kgs. Now the breast tissue also increases, so 1 to 1.5 kg because of that. Now, to give enough blood and nutrition to the baby, the mother's blood circulation also increases, the blood volume also increases. So approximately say 2.5 kgs goes in that. Then around say 2.5 to 4 kgs is the mother's fat gain or fat stores throughout the body. So this is the distribution, how the weight is distributed through, throughout the mother's body. Now, uh, if we calculate about the calories, that how much the mother should be eating, so obviously she has to eat a well nourished, a well balanced, nutritious diet which is rich in protein, iron and calcium. So we have, in weight gain we have to stress about on the calorie intake by the mother. In the first trimester, an average height and weight lady should not gain, should not eat more than 1800 kilocalorie diet per day. So that is first trimester is till 12 weeks of gestation. Now in the second trimester, this calorie intake can increase to 2200 kilocalories. And in third trimester, that is from 28 weeks till term, till delivery, it is around 2400 kilocalories. So that much calorie intake should be there. Now we have, as the lady has become pregnant, there is more acid formation, she will feel more hungry, she would like to eat more. So she has to be very careful what she is eating. So she has to eat a low calorie, a high protein, rich iron rich diet, which is rich in iron as well as calcium. So the food items which should be included, she should be eating frequently and healthy meals. The food items which should be included is that she should be eating whole grain cereals. So she should stress more on oats and quinoa, because these are high rich sources of protein and fiber. Other things like protein rich diet, she should take more of legumes and pulses which are rich in proteins, vitamins, minerals. Then if she is a non-vegetarian, she should take lean meat, which is a good source of choline and high protein intake also. Then salmon fish she can take, which is a good source of omega 3 fatty acids and proteins and vitamins. Now, egg, if she takes, if she's a vegetarian, she can take whole egg. The egg white is rich in high protein, and the yellow of the egg contains high amount of choline, which is required for baby's brain development. She should be eating low fat dairy products like milk, curd, yogurt, cheese. So these are rich in protein as well as calcium. She should be stressing more on green leafy vegetables, dark green leafy vegetables, and broccoli, which is good in vitamins, minerals, fibers, and antioxidants. She should be stressing more on fruit intake also. So, which is again rich in fiber, vitamins, minerals, and antioxidants. So, she should stress more on berries. So, blueberries and strawberries are good source of antioxidants. She can take sweet potato, which is a good source of beta carotene and fiber. Then she should be eating more of vitamin C containing foods, and she should pair these with iron rich foods. So, iron rich foods like pomegranate, beetroot, spinach, and black chana. She should be stressing more on these foods. And when she's taking high iron rich food, she should be avoiding tea and coffee post her meals, immediately after her meals. And she should pair this iron rich foods with vitamin C containing fruits and vegetables. She can add on bell peppers, yellow and red ones. She can add on lemon, amla, and oranges to her food. So this is about mainly about the food preferences. Avocado is also a very good choice of monounsaturated fatty acids. She should be taking almonds and walnuts, soaked almonds and walnuts daily. She should be taking more of seeds like pumpkin seeds, sunflower seeds, and flax seeds. So these are also good source of fiber and antioxidants and proteins also. So once she's taking these balanced diet, she should be walking and doing some exercise also. If she is used to doing moderate kind of exercises prior to pregnancy, she can continue doing these exercises during pregnancy after consultation with her gynecologist if she is fit to do so. But if she is not used to doing exercises prior to pregnancy, she should start with light walk 10 to 20 minutes per day, and slowly she can increase it to say 1 hour also, 2 times a day. So she should be comfortable in doing her exercises and walk, and she should be drinking lots and lots of water and fluids. So that's all in weight gain during pregnancy. If there are any questions, you can just put it in chat box. I cannot see any questions yet. Yeah, so somebody has asked that what about twin cases. So if in twins, I told that 15 to 25 kgs of weight gain is also allowed, is not. So she should, it is not that you should be eating for two, but you have to eat little more, I mean more nutritious diet. How much is appropriate weight gain? I told one, I mean 10 to 12.5 or 13 kgs weight gain is appropriate for an average height and weight lady. Good, there's few questions. Anything else? Okay, so we'll end the session. Thank you so much. Thank you. Thank you, Nikita.